Welcome, Dr. Tabatabai, to our committee. I would like you to start by introducing yourself. Well, this is Ahmed Tabatabai, retired professor from University of Tehran. I have worked in Penn State, University of California, University of Tehran, and Kyoto University, in 4 different universities around the world. My topics, I have managed to work on different topics of research, but one of the my main concern was about the public and the environment, healthy public and healthy environment. The reason being, we would like to see more of people healthy. That restoration, that emergency restoration in medical waste, healthy. My main concern started when I worked with the conservation of tillage, soil conservation, soil erosion, water erosion. So my concern was to have written a book about soil erosion and soil conservation. As a result, I could communicate. I was discussing this in the family gathering with my uncle, who is the CEO of the Merad Hospital. And he said, well, we have another main concern about the medical waste. They're putting all the waste together. They don't separate them. They don't classify them. I work in a fruit bazaar in Iran. They have done it the same way. So grading and separating, grading the quality of fruits was one of the jobs that I have been involved with. And the same token, my uncle asked me, do you want to get a chance? Do you want to get a chance, put a hands-on experience, have a hands-on experience on medical waste? Do consult my employee and hospital employee and experts on the medical waste, generating, hauling, handling, storage, treatment, disposal. You can talk about those subjects with employees, which I did. I'm very, very happy and very honored to be part of the Mehrad Hospital as a consultant for the medical waste project. In that project, I was involved, as I said, with the generating, segregating, handling, and storage, and transferring to the temporary station, creating an environment so we can negotiate with the parts. What do you consider to be medical waste? Well, medical waste is sharps, different categories, several different categories. Anything that is potential infectious to public health would be medical waste. Any waste or any material that is potentially infectious to human health is medical waste. So which should be sharps, hypodermic needles, syringes, any contamination of blood contamination or fluid contamination of human being or carcass or animals parts in carcass, chemotherapeutic waste, trauma scene waste. They are all biohazardous waste. Why do you want to get involved with this area? As I mentioned before, that I like to get involved so I can help the EMB or the program, emergency restoration and medical waste section, medical waste management program, so we can create a better atmosphere, a better environment, and healthier healthier public. How would you recommend that we dispose the medical waste? Medical waste can be disposed in different way. One of them is the incineration by heat, by steams, water spray, or steam water spray, and by incineration, whether it's autoclave or oven, or by mixing them and applying chemical to the waste to create the solid waste. And then we can carry the solid waste to the landfill. Do you have any idea about the medical waste management acts? Do you know anything about AB 333? Assembly Bill 333 is helping medical waste management program is an action plan for concurrent laws and regulation that we can implement the AB 333 to the concurrent law, the existing law. We can implement the the AB 333 to medical waste management program. As a result, we would have better standards, apply the standards, and apply the methods and the policies, implement the policies to the existing policy. That's what we want to do. We want to provide a system that people, the environment, the healthier environment, and safety of public safety. As a result, we have to use the acts and the bill, AB 333 bill. I'm really glad that you provide me a time today to come here and sit down and talk to you. And I am hoping that I'm counting on being very, very valuable to the system, and I can add a great deal of science background and engineering background to the system. Do you know what is your job statements, duty statements, or duty function statements? Well, I was reading that, actually. I read that duty statements, and it has like 40% inspection, 30% research, primary and secondary research, and then 15% of assisting. Always I have to be cooperative or under 100% under the senior environmental scientist or a specialist. I have to follow his order. Basically, that's one of my jobs, but overall in all the jobs, all different functions that I have to do, part of it would be following the orders. On the top of that, I have to be able to find the existing rules and regulations and policies and add to it and implement the AB 333 to the system if they are adding anything. For example, for generator, for hazardous bag and for hazardous waste, how they did define it and how we did define it before. For example, I noticed, I read some in some part that biohazardous container has to have the international symbol of biohazards on it, and it should be readable from a distance away from any lateral direction that we look at the container. But AB 333 is adding, for example, chemo, right? A chemo biohazardous, right? Trauma scene, medical waste act. These are the parameters that we should add to the existing situation. Well, I'm hoping to get the jobs, and hopefully I'll be very frank and open about the jobs. I really count on having to be part of the strong team and to create a healthy environment and to protect public from infected waste or infectious waste, and to create a healthy environment. I thank you very much, and hopefully I hear from you soon. Bye.